All nurses have a place in research, and research itself is an important aspect of nursing care. Now, what is research? According to the National Institute of Nursing Research develops knowledge to build a scientific foundation for clinical practice, to prevent disease and disability, to manage and to eliminate symptoms caused by illness, and to enhance end-of-life and palliative care. Nursing and research can be combined together to provide optimal care based on the latest findings. The effectiveness of research allows nurses to advocate for patients in a much better way and leads to nurses delivering the best possible care. Nowadays, clinical practice is integrated with evidence-based research. This results in evidence-based practice, which means that various evidence is used to either support current practice or guide changes in practice. Such methodology is targeted at providing in the best possible patient outcomes and sometimes lower costs. How is evidence-based practice implemented? The initial practice question is typically formulated into a PICOT formatted question. PICOT stands for Population of Interest, Intervention or Area of Interest, Comparison Intervention of Group, Outcome, and Time. A systematic literature search is then conducted in the databases for the sources mentioned earlier. The quality of evidence in the resulting findings is then evaluated. Upon agreement that the evidence is sufficient and of high quality, the findings are approved for use in the clinical setting. In the application of evidence-based practice, there are 5 general areas in which scientific evidence could be applied to the nursing practice. These are as follows: nursing care intervention, health-related behavior, models of nursing care delivery, management practice, and cross-cultural. There are many examples in each of those areas. One recent example involves applying evidence-based practice to models of nursing care delivery is through pediatric oncology. The study shows best practice and corresponding evidence are evaluated, and, if proven of desired quality, is used in providing care for infants with different types of cancer. In regulation of the nursing practice, research helps develop the necessary practice standards and guidelines followed through the College of Nurses of Ontario, which is the governing body for nurses. This is beneficial for research and regulations because it brings continuous improvement to practice as new research findings arise. In addition to the CNO, nursing best practice can be accessed through the Registered Nurses Association of Ontario. The purpose of these best practice guidelines are for client care and to support implementation while providing optimal care. Although in-hospital nurses may not be conducting the research themselves, but they do require access to them in order to understand the research and to implement the research into their practice in order to provide optimal care.